last year, nearly 3 million cosmetic surgery procedures were performed here in the U.S., a 4% increase over 1998. And a growing number of those patients are men. Our Cheryl Miller has more on this special assignment.
Consider that 76 million baby boomers are just beginning to turn 55, and many are dead set against growing old. Each year, more and more people are turning to cosmetic surgery to correct, enhance, sculpt, or fine-tune our appearance. And more, the patients are men. 55-year-old Dan Simmons is a self-employed contractor and one of the estimated 100,000 men who will undergo some type of cosmetic surgery this year.
I've looked at these eyes for 20 years, and I said, boy, I wish I could change them. And like I said, it was a little encouragement. We're going to get them changed.
Dr. Joseph Niamtu is the oral and facial cosmetic surgeon who will remove the bags from under Dan's eyes and laser peel his entire face to erase wrinkles and age spots. These days, more and more of his patients are men.
There's just a strong desire for, why should only women look young and look better? And it's okay now for men to have cosmetic surgery.
Computer technology allows Dan to get a preview of what he should look like after his surgery. Dr. Niamtu says it's important for the patient to be realistic about expectations and potential results.
The people that are very easy to work on are people that have very realistic expectations. They want to look better. They don't want to look perfect. Everybody that does cosmetic surgery tells their patient that, look, we can't stop the clock, but we can turn the hands back.
So what are most men having done? By far, liposuction, followed by eyelid surgery, nose reshaping, breast reduction, and facelifts. Why are more men choosing cosmetic surgery?
I definitely think that competition in both the workplace and the dating scene for people that are second marriages and situations like that, those social reasons, prompt people to want to look young.
Dan is being prepped for his surgery. Tomorrow, the results.
I think the surprise element is what I'm looking forward to see if they notice it. If they don't, I said, we must not have done too good of a job.
In Richmond, Cheryl Miller, News 6.
Now, for more information on cosmetic surgery or finding a surgeon, contact the American Academy of Cosmetic Surgery information line at 1-800-A-NEW-U or the number 1-800-263-9968. And you can watch part 2 of Cheryl's special assignment, Building a Better Man, tomorrow night on News 6, 11.
Cosmetic surgery to look younger, and these days, more of those people are men. Cheryl has tonight's special assignment called Building a Better Man. Cheryl?
Yeah, staying competitive in a youth-oriented society and having to return to the dating scene after divorce are two major motivators for men considering cosmetic surgery. And as a society, we're living longer, and we want to look good for most of it. So you ready?
Absolutely. I think we're ready. I've been ready.
Dan Simmons is 55 years old and has decided to have his eyes fixed and his face laser peeled for a more youthful appearance. He is among the growing ranks of men choosing surgery to turn back the hands of time. And Dan has chosen 2 of the most popular procedures.
Eyelid surgery is very popular with men. Laser resurfacing for wrinkles and liposuction of the chin or double chin.
Most cosmetic procedures are major surgery with all the associated risks. The expense, often into the thousands of dollars, is rarely covered by insurance. And the hands of time continue ticking, so these procedures are just a temporary fix.
We all continue to age, and really nothing that we do is perfect.
Consider this when choosing a doctor: their training and experience. Make sure they're board certified in this field. Talk to former patients. And make sure you and the doctor agree on expectations. About a month after Dan's surgery, we checked in to see how things had gone.
A lot more people have noticed it than haven't noticed it. And they say, man, you've done something different to your face. And most of them say anywhere from 10 to 15 years younger.
As you can see, results can often be dramatic, both physically and psychologically.
If you break it down to the amount of time that it will look good, it's well worth the money. You're talking about pennies a week. It's well worth that. I think more or less anyone is kind of skeptical when they, go into something like this, but it was over my expectations. I'm very well pleased.
So the question is, did the surgery make a real difference? Take a look at Dan before and after and judge for yourself. Now, Dan said he is going to grow his goatee back, and he tells me he's very pleased with the results, but is planning for just a surgical touch-up of his eyes above the cheekbones within the next couple of weeks. So you decide.